Hi friends, this is Dr. Apoor Mehra and I want to talk about a program called as Conceptual Connect. Conceptual Connect, when I was a resident myself, we used to chase down the teachers to take our lectures because we wanted to find out what will be the questions they will ask us in viva when we finally go for the exams. We also wanted to become better clinicians because we knew one day we will be in open where a patient will be there and we will be there with nobody to tell us what investigation to order, how to do the diagnosis, how to rule out the differentials, how to manage, and someday to manage the complications. So, what was very difficult during those times was to have lectures, to know those questions. And I remember in the rounds, whenever the questions were asked, we will note down in a diary. And we will find out from the books the answers. At that time, finding out authentic sources, reading out different books, and what teachers were saying, catching it on the rounds, was very exhaustive. Now, in the era which is digital, everything is presented on the platter. But what we are doing at Conceptual, we are trying to stimulate your mind. There is a topic that a teacher will take. He will discuss in step-by-step manner involving the subscribers, which they can answer, they can observe, they can chat. Along with, at the end, there's a doubt. Whatever doubt you have, that doubt solving session, the teacher will stay and will answer it. There are multiple teachers in each session. There's an interaction between the teachers so that if there is something missed on, the other teacher will supplement it. This is not high quality. It's a supreme quality with a stamp on it. That's what we call as the line is with a touch of class, with a stamp of authority, as spoken by Harsha Bhogleji. And I took his permission to use these lines for Conceptual Orthopedics. That is what Conceptual Connect is. Conceptual Connect is a bridge between the students and the teachers. They can spend time together, which during our residencies was absolutely rare or not imaginable. But to add spice to it, like an icing on the cake, what we are adding it? We are covering a topic with the subscribers, and after that, we are having question answer sessions over the next week so that the clarity is further. So friends, Conceptual Connect is to gel you together, is to develop your concepts, is there so that you understand what the examiner wants, and also to help you, because finally you have to become a fantastic clinician. So let's connect on Conceptual Connect. Thank you.